Hello, everyone. It's been a couple months since I've had a chance to reach out via a presentation and a video to our Campo Savona family. Hello, parents. Hello, extended families and students if you're watching. I think most of you know, I'm Kathy Hagenbu, Superintendent of the Campo Savona Central School District. And I'm joined today by Mrs. Melda Camp, who is our Special Ed Director and Health Office Administrator. She's been key these last several months. And Dr. Andrea Worley, our school district physician from Guthrie and Corning, is also with us and is going to contribute. And we are really here today. Our goals and our purpose are to share with all of our school community an update on our present status in terms of our health and safety plan. We want to share the most current information on COVID-19 in our county and also in our school district. And finally, we want to share with all of you some information on Governor Cuomo's zone designations in New York State, because there is definitely a possibility that we will be looking at being classified a particular zone. And if so, we want to finally share the process that we would have to use to test students should we be designated a zone, because as we'll share later, the only way to stay open for in-person instruction would be to do random testing. Okay, so a little bit about the current status of our county and our community. And, one of the things as educators, especially in those with growth mindsets who are looking to the future, who are working with young people and young children, we always like to see the glass half full. We like to see things from what is possible and positive. And we definitely, even through these situations, have tried to do that. So I don't want to spread doom and gloom, but it's also important that we are clear in terms of where we stand as an area, and really give all of you the information you need, hopefully, to keep yourself safe and also to understand why we may have to move into a testing situation for students. The community spread, there is significant community spread in Steuben County. That's an unfortunate fact. Right now, both the hospitals in Elmira and the Corning Hospital are near maximum capacity with their ICUs. There is real concern that if this continues and grows, the hospitals will not be able to handle the influx of very serious patients. So this is not to be messed with. As of Tuesday, when I had my weekly meeting with Steuben County Public Health and County Manager Jack Wheeler, the infection rate for Steuben County that day was 7.3%. That's very high, folks. So we are really continuing in the middle of a major community spread of COVID. And what have the challenges been for Campo Savona with COVID-19, really since we opened school in early September? As I said to you last August when I talked to you a couple of times, our top priority is the health and safety of our students and staff. Of course, as a school, our first mission is to educate the whole child and prepare kids to be successful in the world. But given the fact that we are educating in person in the middle of a pandemic and in an area with a high infection rate, we need to do everything we can to reduce the potential that the virus is being spread here in school. And so we have made our health protocols a top priority. And, in a few minutes, I'm sure Dr. Worley will add, but the research continues to get clearer and actually simpler. When this thing first broke last March, we were all crazy and no one knew where, how it was spreading and what to do to prevent it. But face coverings, social distancing, sanitation, and then screening protocols for any organization that brings people together. And in our case, we do it every day in both buildings and all facilities and on our buses is a very, very effective way to ensure we're not spreading it at school. We also, and Mrs. DeCamp in a minute is going to share you with some data, but we have really followed the guidelines from the CDC, the New York State Department of Health, the Steuben County Department of Health, in terms of quarantining students and staff members when necessary. And Mrs. DeCamp will share a little more specifics and reminders about when folks do need to be quarantined in a minute. We have facilitated the testing for COVID-19 when necessary with appropriate staff and students. And finally, we have worked with Steuben County Public Health, and we should put one of those little inserts in, because definitely with Dr. Worley too. We've been in almost weekly communication. She does a great job in her medical practice and answering emails. And we have tried very hard, the principals, Mrs. DeCamp and myself, to communicate with our school community, especially whenever we've had a positive case. My goal has been, as soon as the contact tracing is done and folks who need to know all of the details, all of you are made aware. And those bullets have been really, really big challenges.
Okay, so I am going to share just a little bit more about the specific data that we have that we've really experienced since school started on September 8th. So as you can see here, this chart demonstrates what the number of people quarantined in September, October, and November. So we do have that separated out. You can see in the light blue, those bars represent our students, and the dark blue represents our staff. So as Mrs. Hagenbooth said, there are a few reasons why people would be quarantined. First and foremost, anyone that exhibits any of the COVID-19 symptoms, as those are described by the CDC, must be evaluated. They must be quarantined first, so they cannot be in school, whether they're already here and we send them home, or they are at home and their parent reports that they have symptoms. They must follow up with their healthcare provider and provide a confirmed appointment within 48 hours to the school. And then from that point, after they see their healthcare provider, they will either be provided an alternate diagnosis, if appropriate, or they'll be referred for testing to rule out COVID-19. And so while all of that happens, those people will be considered quarantined. There are other reasons to be quarantined as well. One is any person that has been a close contact to a person that has tested positive for COVID-19. They would be under what is called a mandatory quarantine placed by public health. But also, we do have some folks that are quarantined based on other outside circumstances, either personally or just within their family. So those are some of the reasons why people would be quarantined. Now, here are the number of folks that have been tested. So again, why would someone need to be tested for COVID-19, especially in relation to being in school? And the biggest reason for that is anyone that does exhibit any of those symptoms that have been referred to their healthcare provider by school. Those folks, if they exhibit those symptoms, most often their healthcare provider will then refer them for a COVID-19 test. And that's really important because if they have any symptoms, sometimes they can look like other illnesses, which Dr. Worley has shared in the past, and I'm sure could share again. But they really do have to rule out whether or not that person has COVID-19. So those are really the biggest reasons. We do also see other folks that are tested due to being close contacts with someone that has tested positive, and then also for some other personal reasons. So as you can see, again, the light blue here represents the students in September, October, and November, and the dark blue represents our staff in September, October, and November. And then we have the number of confirmed positives as of November 30th, 2020. And in this one, you will see there is a third column, a third option, and that is BOCES staff or other. We do have some contract employees that do come into our district from other agencies, and that's really what represents that gray bar. But again, you can see we have the light blue are the students, and the dark blue are our staff. And if you as a parent, and I can say we, because I am a parent of Camp El Savona students, we really do worry. How many positive cases do we see in our community? And as you can see here, we have 5 as of right now. And I'm going to share one more set of data. So when you look at the number of quarantined all the way to the left, yes, we have had 402 students between September 8th and November 30th that have been quarantined. However, we've only had 5 positive cases. So that number really shares a lot of information. What that shares is, although that number seems high, the guidelines that we're following from Public Health and Department of Health and the protocols that we've put in place here at school have kept our students really safe. So we've seen a very low number of positive cases here in our community, which is really wonderful to see.
And Mel, can I add just one thing to that? One of the things that we've also done is worked very closely with Steuben County Public Health on what's called contact tracing. So when we do have a positive, anyone who's come into potential close contact with those folks must quarantine. In many cases, those folks have chosen to get tested.
Correct.
And as the days and weeks and months have gone by, often it's reported that the positives have been close contacts of someone outside of the building. And we have no direct evidence that there's been any spread in our school. Now, can we say that with 100% certitude? Absolutely not. If I could, I think I'd be working at the head of the Centers for Disease Control or something like that. But all of the folks who were quarantined and or who got tested did not exhibit symptoms. So going back to what I commented early in terms of our protocols, we really are starting to have a lot of faith in the masking, social distancing, sanitation, and screening protocols. They seem to allow us to come together. To date, we did have that one period where we closed our high school for 2 weeks because we had 2 cases closely back to back. But even then, in subsequent investigations, we don't feel that there was spread. It was just too early to know that. So I think we, as positive as we can feel about saying that our environment here when the kids are here is safe, we do. Nothing is for certain 100%. But I did want to add that. Thank you.
Awesome. Thank you. So at this time, I'm going to introduce Dr. Andrea Worley and just ask Dr. Worley, do you have any thoughts on, from your perspective, the status of our community, the county, and any of the data that we shared?
Absolutely. So I definitely am concerned about the rising rates in Steuben County. I'm concerned about the capacity of our hospitals to care for all these patients. I know it's something that both hospital systems in the area are looking at really closely. I am reassured, though. I back up what Superintendent Hagan said, that I don't think in-school spread is significant. I think the things our school's doing is keeping our kids safe. And that's very exciting for me. And it makes me very happy because I really do value the in-person instruction our kids are getting, but I want them and their families to be safe. If you look at the Steuben County data, the most recent press briefing that came out, only 1 positive case was from the 0 to 9 year age and 1 positive case in 10 to 19 years. So our school age children are really, not a significant percentage of the number of positive cases we are having. However, they are still present. And so we still need to be diligent in our protocols and our procedures in sending kids home and testing kids. We really need a low threshold for testing kids because we want to decrease the spread as much as possible.
Very good.
Great, thank you.
Thank you.
Okay, so I do want to talk a little bit to parents and families about the most recent updates from New York State and the impact that they have on all of the state, our region, and definitely Camp El Savona. As this pandemic has continued, as the science has evolved, as we and the state and the federal government has gotten more information, the expectations, the regulations, the requirements have also evolved, trying to stay as much ahead of it as we possibly can. And there's been additional executive orders from Governor Cuomo and required regulations from the New York State Department of Health. So probably the most relevant and the one we wanted to talk to you about today in terms of realistic potential for our community is the zone designations. So probably 2 months ago, in response to the rising COVID rates across the state, I think these rises, Dr. Worley can correct me, but I think late September, early October, not surprisingly, when folks came inside a little more, the positive cases started to rise. Also, if you're in a region where there's been what they call micro clusters, and both in Chemung and Steuben County, we've had micro clusters, be it at businesses, be it at healthcare providers, be it at places of worship. And a one microcluster can result in hundreds and hundreds of positive cases, especially if the contact tracing and isolation and quarantining doesn't happen in a timely way. So as a result of that, the state government has been looking at regions, and actually they drill it right down to census blocks. So they track the positivity rates of census blocks across the state. And if a census block rises above a particular percentage, then they are deemed over a 7-day average. Then they are deemed either yellow, which is the lowest level, orange, which is mid, or red, which is almost a complete lockdown like we had back in the late winter, early into the mid-spring. So you'll see on the screen there, really the three things that I think matter most for our community is, what does it take to get you in the zone? What are the implications for a school? And then how do you get out? And there's quite a lot of data there, and you can obviously review it at your leisure, but the big pieces are if a region has a positivity rate above 3.5 over, I believe, Dr. Worley, it's a 7-day rolling average, is that correct? Then you would be deemed yellow. If it's 4.5 orange and 5.5 red. You may be aware that most of southeastern Steuben County was deemed yellow back in mid-October. Camp El Savona School District missed that by about a matter of a mile, because what the state says is if one or more of your school buildings are in that region, then you're yellow. And the yellow zone kind of creeped towards us, but it didn't quite make it. Both Corning Painted Post and Addison were in the yellow zone. And because it was new, and they ended up closing for in-person instruction, but they did have their staff in. Chemung County has a higher infection rate, and they were and still are in orange zone. Basically, I'm going to really talk mostly about the yellow zone, and we're going to continue with what that would mean for us, because frankly, should we become orange or red, there's probably not much of a possibility we'd be able to remain open for in-person instruction. So let's keep our fingers crossed that should we be deemed something, it's yellow. We're assuming that would be the case because right now we're not deemed anything. So what does that mean for us? If you look at the yellow column, if you want to go back now, sorry, I was going to walk through that column. Once again, our infection or positivity rate above 3.5. If so, in order to stay open for our staff to report to work and our kids to come to school, we would have to test 20% of the staff and students if they continue attending over a 2-week period. The good news is that if we did test we could discontinue testing if our positivity rate was below that of our region. And given what we've seen in our community, we think there's a very strong possibility. And I think this is the state's way of saying they're starting to see the schools are very safe places. So even if the community isn't, let's get the kids in school. A, it's best for their education, and B, people are starting to see how safe it is, and the chances of them contracting it are very small. So that's what it would mean for us if we were yellow. Now you can go ahead now. So why might we need to test? So if one or both of our schools are in a census zone that's deemed yellow, orange, or red, but once again, the red criteria is so high for testing, we don't think we would be testing students, and those probably staff. So with the goal of random testing is to ensure that a zone school, a school in a zone, is not contributing to community spread, and that it also, will determine that the environment in the school is safe, even though the environment in the community is not. And then rapid testing will also ensure that if we do have positive cases, because sometimes kids are asymptomatic. Obviously, if they had a symptom, they wouldn't be in school. But we always worry about those asymptomatic carriers, and we would catch them with the rapid test and they would be removed. Once again, keeping our community safer. Okay, so who would be tested? As I said, 20% of our students, faculty, and staff over a 2-week period, if they report for in-person instruction or work in any of our buildings for staff members. So for our white teen students, the students who are 100% remote, you would not be part of this. The random individuals will be chosen on a rotating 2-week basis. Every 2 weeks, we would take a random sample. When our positivity rate fell below the region, then we would be able to remain open and discontinue testing. So we might only have to test for 2 weeks or 4 weeks. And then even if the area was yellow, we could discontinue testing and remain open. Where would it be tested? In the health office suite, in an isolation room, by most likely one of our nurses, or definitely a trained healthcare provider with lots of privacy. And it would be the kids would be tested when they were attending for in-person instruction. Okay, so how will the test be done? So the state will provide us a 15-minute rapid test. It's an Abbott Binax Now card is the technical term, but that would be provided by the state. It's a nasal swab that is inserted into both cavities of the nose, less than an inch, depending on how big the little nose is. It's going to be a lot smaller, for a lot shorter insert for some than others, and they swirl around 5 times. We're going to show you a video of this with that kind of explains it. We're having technical audio problems in our run through. We couldn't get the audio to play. So as the video, as the bullets come up explaining, we're going to have Dr. Worley talk a little bit about that. So Mel, you can go ahead and start the video for folks.
So to collect the nasal swab, what the provider will do is just stick the Q-tip. It's about the size of a Q-tip, the swab, up in the nasal passage, like Superintendent Hagan said, less than an inch. So typically about 1/2 inch is how much I do for children. And gently rotate it in the nares for about 5 times. Takes about 10 seconds. And then you do it both sides. So that the nasal swab requires both sides. It is a nasal swab, not the nasal pharyngeal. So it's not tickling the brain. It's just in the opening of the nose. It makes their eyes water, sometimes makes you sneeze. I would say 50% of kids laugh through it. So it's not painful, it's non-invasive. It's really, really easy and straightforward.
And about how long would it take to administer that?
So it takes about, I'd say 20 seconds, because it takes about 10 seconds per side, 10 to 15 seconds. So they'd be done within 30 seconds of the actual collection.
Right, and so some of our area districts who were in the yellow zone did do some testing of students,
Mhm.
and they reported that it was very I don't know if you can use the word pleasant, but it certainly was not a stressful experience, especially if the kids are well prepared for it and aren't feeling anxious about it.
Mhm.
Go ahead, Mel. You could, I think, okay, we already, okay, there we go. So, um, uh, parental consent for COVID-19 testing. Um, we will not test any students without parental permission. So I just want to make that clear. Parents don't need to worry that all of a sudden my kid's going to be tested. I'll have no idea. I mean, we will, and on the screen here, it's really small, too small to see, but posted with this presentation is also a copy of the actual form. We won't send those out unless we're deemed yellow, but if we're deemed yellow, probably that day or the next, you would be looking forward to getting this in an email, and probably for the little ones in their go home folders. Um, so it would, we will hope that because we all believe that it's best for kids and for our district to stay open and to continue in-person instruction, we hope that parents will be comfortable giving us permission to potentially test their child. Remember, we'll only take a random sample of basically 10% of our students a week, and those will be the only kids who are tested. If a student is randomly chosen for testing, the parents will be informed by email before the day of testing. It might be as close as the day before, but you won't find out after the fact that your child was chosen and tested. Um, if a student tests negative, we will, obviously the parents are going to be awaiting this because they'll know that their child was being tested. We will send those results the day of the testing. If by chance, you can go ahead, Mel. If a student should test positive, obviously they would be removed and placed in isolation, and the parents would be asked to come pick them up and to have them seen by their healthcare provider. As I said, students will not be tested without parent permission. If a student is randomly selected and we do not have permission on file, we will reach out to you to discuss the situation. And that will be an opportunity for you to express your concerns or to ask more questions, or maybe to say, oh, I forgot to send it in. Here, I'm shooting it in right now. You parents would have the option to take their child to their family physician. Maybe some folks would feel, I want to be there. I want them with their doctor they know, and that would be fine. We would have a, probably a 5-day window for that to happen, but you could certainly schedule that when it worked with your family. But if we cannot get consent for testing, then that student would be required to quarantine for 10 school days. And that is the strong recommendation of the New York State Department of Health, the Steuben County Public Health, and also our school attorney. Why, you say? Why my kid hasn't exhibited any symptoms? They haven't been in contact. However, we are in a region, and if we were deemed yellow, it's because there's lots of it out there. And we also know that kids often do tend to be asymptomatic, not always, but often. So just because they're not showing it, if we can't test, then we can't say to all of you, we have a low infection rate. So it's really to ensure the best to ensure, number one, that parents can continue to send their kids to school and feel like they're not at risk. And number two, to meet the requirements so we can stay open. And number three, if parents are not comfortable with this and not comfortable with this direction, we certainly have a strong remote program. We have about 20% of our students that are in remote. Our teachers are very attuned and have developed and continued to improve that. So your child would continue to be educated just at home. We hope that most folks would be comfortable, and we would certainly be willing to talk with you individually if it got to that. But yeah, so that's, and this permission form will be posted, is posted on the website. So please take a chance to look it over, reach out to myself or Mrs. DeCamp if you have questions. But should we be deemed yellow and your child is chosen to test, we hope that you would be anxious to ensure that A, they didn't have it, and B, that other kids were also being tested so that we weren't at risk of having an unsafe environment for kids to attend in person. And Dr. Worley, your chance to add to that.
Absolutely. So I definitely think this rapid testing has a place in looking for asymptomatic spread in our community. And I see it as an opportunity to confirm all the good things we're doing. The more negative kids we have at school, the lower our rates will be, is the positive spin on this. My husband keeps telling me to test all the well kids so that we can keep our numbers low and keep our kids in school. I think that the rapid testing does have a place. I think the procedures work really well. I've been through this process with the Corning Bay Post School District and feel confident with the nurses and the medical providers who are doing these tests, and think it can be run very well, and really want to ease your mind on those things. I do want to say, though, that this is not considered a diagnostic test, and that if your child is negative, please don't arrange a play date for the next day, okay? So this test, I don't want to falsely reassure anyone that we don't have COVID, we can go behave in any way. I really, really, really think there's importance to social distancing outside of school. So our schools are doing so much good to keep our kids healthy and keep our kids there. It is on us as adults, especially the young adult 20 to 30 year age group, to make good choices to support our schools and our children, especially going into holiday season. And that's my soapbox. I just had to.
Thank you. And frankly, to make sure our region stays open, to keep businesses open. I mean, should this get out of hand, if we're deemed red, we'd go back to the lockdown situation, which is, really is a real burden for folks. So there's lots of rationales for really taking this as seriously as possible while continuing with our new normal.
Awesome, thank you. So as Superintendent Hagenbu did mention earlier, we do have some area school districts that that were in the yellow, and they did have to begin testing. And so in communication with them, but also just within our community, as we've been working on our protocols, we have heard some of the questions that are out there. So we just wanted to reiterate and summarize some of the answers to those more frequently asked questions. So first, why would my child be required to be tested for COVID-19? So if one or both of our school districts are designated in the yellow zone, then we will have to test 20% of our staff and students over a 2-week period. And of course, that would be just for the students and staff that report to school in person. So this does not apply to our 100% virtual students. And that will be a random selection. So your child may be selected to be tested, but they may not. So it will be random. So that would be the reason why they would be tested at school. Will I need to provide information to the school regarding COVID-19 testing? So the consent form that Kathy just shared is what you will have to provide to us. So should one of our school buildings be designated yellow, we will immediately send out that consent form so that can be completed and sent back to the school as soon as possible. And what that consent form asks for is the most recent contact information for you, as well as your child's identifying information. So examples of that would be their name, date of birth, your address, their address, phone number, and a more recent email for the communication regarding testing and the results. Will I know if my child has been tested? So yes, you will know. You'll be notified if your child is selected via email at least the day before, if not more. And then again, the email will be sent to parents of students who tested negative during that day. But if the unfortunate event happens that your child tests positive, then you'll be called immediately. What happens if I do not give permission to my child for my child to be tested? So if on that random draw your child's name is chosen, first we'll give you a call to talk about it. Also, you will have the opportunity to have that testing done elsewhere within a certain time frame. But ultimately, if you decide that you do not want your child tested at school, then they will need to be sent home and will need to self-quarantine for 10 school days. And then just a brief summary of how the testing will happen at school. So again, it will be a random selection of 20% of our students and staff over a 2-week basis. Randomly selected students and staff will be tested during that time period while they are in attendance at school. So we will not be asking students to come in on days that they are typically remote. This would take place while they are in in-person attendance. Parents of chosen students will be informed of their child being tested. That will be done via email. So it'll be really important to make sure that the most updated email is on that consent form. Your child will be sent to the health office when it's time to be tested, and they will be placed in a discrete location. In both buildings, Campbell and Savona, we do have a space available where we will be sure that that will be discrete. And their testing sample will be in a discrete location as well, so no one else will see that. The school nurse or another healthcare provider will administer this test by placing the small Q-tip-like collection instrument into your child's nose. Again, not even a half inch, no more than an inch. And that will be swirled in each nostril at least 5 times. And then it gets placed into a card where it will be able to process. And again, it takes approximately 15 minutes for that sample to be collected and processed for the result. So those were the main questions that we've heard out there. However, we understand that there may be additional questions that you may have after watching this presentation and after just seeing what's happening in our community. So if you do have additional questions and you would like to have the opportunity to ask those, we have created a form for you to complete. So you'll have to go into the browser of either a cell phone, laptop, computer, tablet, and just type in this URL right here, tinyurl.com/CS COVID testing. And that will prompt you to give your information, as well as let us know what grade levels your children are in at our school. You are able to choose more than one. And that's just an opportunity for you to ask any additional questions that have come up as you've been watching our presentation. And again, that will be available to you through Friday, December 11th at 3 o'clock. Back to Superintendent.
Yeah, so in summary, first of all, thank you so much, Mrs. DeCamp, Dr. Worley, for your expertise and your wisdom, if you will. In closing, at the risk of being a bit dramatic, every generation has its challenges. Every generation, when it's looked back upon in the history book, says this was our finest hour. This is when we rose to the challenge. My grandparents' generation lived through the Great Depression. My parents' generation was the greatest generation who fought World War II. Now our really combined generation, the baby boomers and those that have followed us, I'm one of those oldster baby boomers. This really is our challenge. I've heard as information has been shared about this pandemic and soon to be the vaccination. We didn't talk about vaccinations today because it's a little premature, but Dr. Anthony Fauci, the director of infectious diseases for the Center for Disease Control in outside of Washington, said the other day on Good Morning America, the cavalry is on the way. I loved the quote. And what he meant was these vaccines are on the way. So this is going to end, guys. We are going to get back to a normal world, but it's not going to be in December. The first vaccines are going to go to the most vulnerable and then probably healthcare workers. It probably will be spring or even summer until we're all able to get vaccinated. So this is our opportunity to continue as a nation and as a community and as a school district to work together to do the best we can and in our world to keep our kids in school, to give them as much authentic education experiences as possible, while also keeping safe in a pandemic. And as the days and weeks have gone by, we are more comfortable and more confident that kids are safe when they're here. However, the pandemic outside of our walls is bigger than we are, and we may have to make some adjustments. And we really hope that all of you feel a little more informed. And once again, as Mel said, if you have questions, please feel free to complete that form. We will do our best to get back to you in a very timely way. By the way, very last piece, should we be deemed yellow, I will definitely do a live town hall at that point, kind of updating things, giving a little more specifics, probably a little more technical question and answers then if we know we're going to have to test. So be paying attention to your email, because information about that would come via email. So that's all. Thank you very much. Enjoy the weekend if you happen to be watching this on a Friday or Saturday, or certainly best wishes for a healthy and somewhat socially distanced holiday season. So thanks so much. Bye-bye.